Another component of history taking that is very, very important in all aspects of medicine is family history. So a patient came with a complaint, and you are trying to also know that does anybody in your in your family have this similar issue, or is there any other issue in your company of your family that is likely to move from one generation to another? So of course you are asking this question. This is because you want to know if this thing is family linked. Okay, because when you know that something is family linked, your approach towards it changes, because it's not something you can really solve when it happens. You understand? Or if there's something that runs in the family but hasn't happened, then you can advise the patient further, like, have a look, this thing runs in your family, you have to be careful, this and that. Okay, so history taking, that's taking family history. So it's just a vital part of prenatal care. It helps to identify genetic risk, like, is there anything that actually runs in the family? So for a pregnant woman, you're actually trying to do this in respect to the baby. Do you understand? You are trying to pick up if the baby is at the risk of having any issues, right? So you are trying to check out for genetic conditions like sickle cell, thalassemia, cystic fibrosis, Tay-Sachs, pregnancy complications. If your mother or elder sisters have ever had any pregnancy complications like high blood pressure, gestational diabetes, preterm birth, so you know that you are at the risk of having it. Congenital anomalies, to check out if there's mental health issues, to check out if there's chronic diseases running in the family, all those diabetes, hypertension, thyroid disorders, autoimmune diseases, and all of that. So why should it actually be asked? Now, you typically focus on first degree relatives more. So it's what you get from the first degree relatives that you mostly work with. But how about this person doesn't really have all those siblings and all? You can move to second degree relatives, and you can even ask about the family of the partner. So key questions is things like, is there a history of genetic disorders or birth defects? So if the patient doesn't actually understand what is genetic, you have to actually explain the way they understand. Okay, any relative with chronic illnesses? Is there any history of mental health conditions? Is there any pregnancy related issues with the women of the family? Then any known carrier status for inherited disease. So how is it used? May actually help you to counsel the person. If complications will come up later, you tell the person before time. Alright, it will reduce the shock. Alright, it guides decision on prenatal testings, helps tailor monitoring and interventions throughout pregnancy. Okay, so that's it for the importance of what family history taking in a pregnant woman.